And we're live. Hi, I'm Autumn Keynes, and I'm with Virtually Connecting. We are here with the QUB conference, and I'm going to turn it over to Rebecca Hogue to do some introductions.
Yeah, you guys can tell us how.
It's not normally pronounced as quab, but that's quite funny.
Thank you for correcting me.
That's okay. If you saw our premiere, we also had electronic patients, so we're doing really well. It's Rebecca Hogue here from Virtually Connecting, and I'm on site in Belfast, which is really kind of exciting. And I'm going to pass it over here to introduce.
Hello, I'm AnneMarie Cunningham. I live in Cardiff, but I'm from Northern Ireland, so it's really nice for me to be back here. I'm a GP, and I'm speaking at the conference.
Hi everyone. I'm Stephen Wilson. I'm the organizer of the conference. I'm from a humanities background, a literature background, and I work with the QUB Health Humanities Research Group.
Okay, and online?
Why don't we start from, I'll call you each out from my left. I know it appears differently for everybody. Kate, can you introduce yourself?
Sure. I'm Kate. I work in a humanities faculty. I'm a humanities academic and I'm a cancer patient. And so I've come to this from Rebecca's invitation to join as a person who writes intermittently about cancer online.
Thank you, Kate. Welcome. Marie?
Hi, I'm Marie Ennis O'Connor. Excuse the croaky voice. I have bronchitis. I'm missing the conference. I'm so upset to be missing because I'm supposed to be speaking tomorrow, but I hope to send in my presentation virtually, and I'm just so grateful that I have an opportunity to be part of this. So, yeah, fantastic. Thanks for organizing it.
Wonderful. Thank you for being here, Marie. And Terry, you're next.
Hi, I'm Terry, and I am from Arizona in the U.S. I'm a breast cancer and it's 2:30 in the morning here, so I haven't had any coffee yet.
I'm really impressed that you came, Terry.
Welcome, Terry. We're really
I'm
excited
barely
to have
out of my pajamas here. Anyway, I am a breast reconstruction advocate. I'm a 2-time cancer patient. I blog, write, and do educational outreach, informing women of all of their breast reconstruction options after they have faced a mastectomy. I personally have had the deep flap autologous flap surgery to reconstruct my breast, and so just doing a lot of outreach, and I'm really impressed and excited for having the opportunity to join Virtually Connecting today, and I'm very impressed. I got that out after being out of bed for 5 minutes.
Welcome, Terry. Thank you so much for being with us today. So I'm going to ask the virtual participants if you can mute your microphones just in case we have any background noise, and I'm going to turn to our on-site folks. Can you tell us a little bit about the conference and how things are going there?
Yeah, I'm going to pass this over to Steve to tell us a bit about the conference and the different types of people that are presenting. And
yeah, so basically the conference is, we've got a 2-day conference. We've got delegates coming from the States. We've got lots of local people, with people from humanities backgrounds, from medical backgrounds, from medical practitioner backgrounds, with some social scientists. I think one of the great things about this conference is the diversity of people that we've got here. We've also, really importantly, got some patient bloggers with us as well. So we've got a really fascinating sort of collection of people that are with us for the 2 days. And I guess we're going to be looking at some of the pros and cons of the e-patient phenomenon. I mean, I'm very interested, of course, in the kind of therapeutic benefits of this and some of the ability that this gives patients to maybe take control of their experience, but I'm also really interested, especially following some of the controversies we've seen recently, particularly in the States, about some of the negative repercussions of all of this. I'm thinking about some of the ethical and even some of the legal repercussions of it. So these are the sort of questions we're going to be asking over the 2 days from lots of different points of view, medical and humanities working in real collaboration and proper collaboration with each other.
Cool, thank you. And I'm going to pass over to AnneMarie. Actually, I know Steve's going to have to run momentarily. I wonder if anybody had any questions for him before he has to leave. I'm getting muted microphones.
So we'll give people a little bit more time, but I'm very new to all of this, so I don't, I mean, for you to say all of that, it's fascinating to me, but I'm wondering if maybe you could talk, especially I'm in the States, so what are some of those ethical implications? What are some of the things that maybe have happened in the past? I'm very new to all this, so forgive me if it's a naive question.
Sure, no, it's a really good question, actually. Some of the controversies that I've come across recently have been where patients have revealed the identities of their doctors and maybe implicitly criticized or even explicitly criticized some of the treatment that they've had from their doctors on their blogs, and doctors have then called patients in to speak about this, and this has affected the doctor-patient relationship in some of the cases that I've written about. So that's one of the big things that I'm interested in. The other that I've heard about is that there are some patients who are actually being asked to sign pre or sort of foreclosure agreements or pre-closure agreements, I guess, that they will not disclose publicly on their blogs about some of the treatment that they are receiving and about the relationship that they have with their doctors. So these are two of the big areas that I personally am interested in.
Can I just say something? Is that okay?
Yeah.
Yeah, hi, because I'm covering it in my talk tomorrow. I wanted to cover it in my talk tomorrow, which is that it's slightly different, but I absolutely take what Stephen is saying, but just slightly different as well, is that we can be very vulnerable online, and sometimes what we write can be taken out of context. And in my presentation, I'm using an example that happened in the States. I'm not sure if anybody's aware of it, Lisa Adams and this big controversy. So it just raised a lot of very, very interesting questions about how do we protect ourselves online. And just because we say something online, does that give everybody the right to take that and to take it out of context? So it's something that we haven't resolved, and I think it's a really interesting question. So I just wanted to add that as well to what you were saying, Stephen.
Thanks, Marie. That's a really good question. That's a really good point, actually, because we do talk about, sort of doctors and the medical professions who are protecting themselves. We do have to, really importantly, think about patient protection online.
Awesome.
I'd like to add something, if I might.
Sure, go ahead, Terry.
Just real quickly, I guess that's an interesting comment about signing the disclosure. I had a very positive experience with my doctor, and so I guess my main thrust in my blog and my outreach is to let other women know about this positive experience, because the the procedure that I have is so specific and it's so highly skilled that there's very few microsurgeons that even do it. But signing that form is interesting to me, because I know as I read other blogs and look on my Facebook platform, there are some very caustic comments made from people, and I've even had to block some members because of it. So this is an interesting concept to me, and I didn't realize that patients were signing forms. Had no idea about that, so that's really good information for me to know.
Brilliant.
Great. Okay, Steve's got to run, and I'm going to pass over to AnneMarie to give us a little highlight about what she's talking about in the keynote today.
Okay, so I'm coming at this in a way from a clinical kind of background, but I'm mainly going to talk actually a little bit about my own experiences as being a kind of like an e-patient, which I've never talked about before, so it's a little bit scary. And I also am going to talk about what we think we need to do really in education to be able to get people, because I don't think that doctors should be, in a way, turning this into something transactional with pre-disclosure and or whatever it's called. I don't feel that comfortable with that personally myself. I still like to think about medicine as being practiced within the context of a relationship, and I think that within that relationship you should be able to talk about it. You might even be supporting your patient in actually talking and disclosing and sharing with others, rather than being worried about what they're going to say. That's if you're worried about what they're going to say publicly, you've actually got a problem in your doctor-patient relationship kind of inherently. So I think that's probably the bigger issue, and to move it from being this relationship to transactional is quite worrying. So I think I don't really know what everybody else is going to be saying at the conference, and I think it'll be I get to speak first. Nobody gets to interrupt me, so I can say my bit. and then I might spend the rest of the time actually disagreeing with everybody else. I don't know. It's going to be a big kind of learning experience. Hello?
Any questions online?
I agree with AnneMarie. I feel very uncomfortable about that as well, about the signing the non-disclosure or whichever form you sign. It's that doesn't sit well with me either, and it's interesting. That's going to be a very interesting debate. And also the patients that I know online, I cannot imagine them signing something like that, because they are not the kind of patients who want to be silent or who accept being silenced at all. So I think that's quite interesting. I'm certainly going to be following up on that, because it's the first time I've heard of it as well.
Yeah, I certainly would never sign such a thing. But what's interesting is I teach a Should I Blog course, which is how I know most of the people online here. But in that, one of the first things I say is, like, my blog is about me. It's not about my physicians. So I actually don't name any of my physicians by name. People could probably figure out who they are, because they do know that I do mention many times that I'm treated at Stanford and I'm treated at Palo Alto Medical Foundation. So people could look up based upon where I'm being treated and probably narrow it down. But I don't name them. If you Google searched any of my doctors' names, you would not see that relationship, because I think it's not appropriate.
I think that raises a bigger question as well about etiquette around what our responsibilities are, both as patients and as clinicians. So what are the responsibilities? And I think we need to do an awful lot more education around that and awareness around that, because we've jumped in, feet first, everything into the online sphere, and we've raced ahead of even just basic courtesy. So it's an interesting, wider question that we need to start addressing.
So we have a couple minutes, and then we got to run because AnneMarie's got to get set up for her keynote.
People are starting to come into the room.
And people are starting to come into the room, so we're going to lose our space. So any last-minute questions?
Please tweet a lot. I want to see what's going on, hear what's going on. So please tweet.
I'll do my best.
Thank you for making the time. This has been really interesting to hear. It's lovely to hear all of these different voices. I think my question, which isn't really necessarily for now, but for the conference as a whole, is what we do about the differences between different national health systems and the kinds of advice that patients might give each other in different situations, because I know that Rebecca's experience has been very different to mine, and I think there are some risks in the online space that patients become poorly advised by each other if they don't know about those different health system preferences. Health is not a generic global state of affairs, and I think that's something I'm quite interested in learning from other patient bloggers, how we become kind of specific.
I'm just going to say in a Facebook group that I'm in, one of the posts that's pinned at the top of it says, how do you think your treatment, the person that's asked this question is wondering how people think their treatment has been different based on whether or not they live in somewhere with more public or more socialized kind of health system or more private healthcare, and that influenced the treatment. And that started a really nice conversation under it about different sort of treatment options and different things like that. And it's just very interesting that went into, because the other thing for me then is I have more of a doctor identity now as well, how participating in these groups without like being a doctor too and giving too much advice and saying, no, you don't need to get that done. That's, we go and talk to your GP, but I don't think you need to get that done. And so it's an interesting, but at the same time I feel, well, I would say the same to somebody that I would to anybody else living in the street. It's not like giving advice, it's just kind of like sharing my knowledge. So I think it's true that can happen, but most that I see are reasonably well moderated and sort of controlled. And I think that there's a lot of fear from clinicians about this, but whenever you're actually within these groups, you see that people are actually sometimes really quite ultra careful about it. And there often is a lot to be shared, usefully shared, but I think that often people say, oh, you must speak to your doctor, and we don't give advice here. Actually, one of the most interesting blogs, I don't know if you did look at it, is Liz O'Riordan's, she's a breast surgeon who's now going through breast cancer, and she's very technical with her kind of advice there about all the rest of it, because she's able to come, she's like so glued up already that she's able to get into an extra level of being able to give information. It's fascinating. But she's added on to it, you know, it's not medical advice. Here's Victoria just turning up. So,
okay, so
we better go.
We're on the internet. We're going to pass over here. Yeah. So people, so people are starting to arrive. We're going to have to jump off here, but we're going to encourage you to continue the conversation for a bit before you guys finish off, but we have to jump off. People are coming into the room.
Rebecca and Anne, thank you so much for being with us today.
Thank you.
Bye-bye. Bye-bye.
Bye-bye.
Thanks, Becky.
Okay, and they're gone. I just want to remind everybody that we are still recording and we are still live. I know sometimes when you get into the conversation you even forget, but it is nice sometimes to have a little bit of time to process the conversation. So if you guys want to continue to talk, I'm more than happy to stay here with you and contribute where I can and listen to you.
We're stunned into silence.
Yeah.
Well, that is just really good and new information to me because, as I said, Marie, I don't know, how much you get a chance to read my blog, but I embed URLs to my doctors. Yes. Because, as I said, I had such specific, detailed, and highly skilled surgery that there's so little information out there about good doctors around the country that's my focus. And, in terms of, that's what I do in my blog, but then I have a Facebook group too for a forum. And in terms of that, I think that you have to be, at least from what I've seen in the few months that I've been doing this, I think that you have to be very careful in your the wording that you use and the rhetoric that you use on those forums so that you aren't giving medical advice, and you disclose that pretty clearly on your site. I know the doctors, I think I have maybe 8 what I call guest doctors now on my Facebook forum, and I think those doctors, I vetted them carefully, and I think that they're so confident in what they do and with patient doctor relationships that they're okay, giving the advice that they do, and they're pretty careful too about their rhetoric and always saying, please discuss this with your healthcare professional.
So yeah, it's really interesting to me. I'm very new to all of this, and I guess I can see how it might be somewhat intimidating for a practitioner, but it also seems to me, because I come from an educational technology background, I've been thinking a lot about digital citizenship, right, and like sharing in a public commons, and it seems to me like to shut somebody up, kind of, for lack of a better, like you are not going to talk about this in public ever, especially for something so personal. It just seems to me that there's something wrong with that.
Mm-hmm. I think you're absolutely right as well, Autumn, about the digital citizenship, which is a much better way of putting it than I put it about the etiquette, but it's the same kind of thing, is that we really need to do more work around that. I don't know where we start with that. Maybe we need to, you mentioned education, maybe we need to start in schools, not just teaching the tech, but teaching how can we use the technology in a way that is, ethical, in a way that makes us a good digital citizen. So I think we need to start having wider conversations around that.
I think you're absolutely right, and it's really, that's where all of this, I feel like, kind of connects with my field, right? Because I do think there needs to be more education. We spend so much time on what we call digital literacy, right? Making sure that you know how to do these things. And so, you can teach a man to read, but you can't teach a man to think. And I didn't mean to gender that, but you know what I mean? You can teach someone to, consume information or to put information out there, but to teach them about you need to be responsible and you need to be safe, you need to protect yourself, and where do you find the balance between those two things of expressing yourself but not hurting others,
and also protecting yourself as well, because that's the other thing, is that we're not protected. We're not protected online either, and we're not really aware sometimes of the implications of what we're doing. And that's been fascinating. Even just in the short conversation we've had now, so much has come up. My head is spinning already, and so much has come up. It's such an interesting, wider discussion, and it's fascinating.
It really is.
Well, I find that very interesting too. I like the word digital citizenship because, in my former life, before I became a blogger, I was an elementary school teacher, and there is a lot to be said about that, Marie and Autumn. Teaching students early on. I think this could be very valuable to start teaching this early on about how to be good digital citizens. So I like what both of you said about that.
And I think it does go back to the idea of the internet as a public commons, right? It's supposed to be a public utility, I guess, for lack of a better word, and it does open up lines of communication where we've never had it before. I would never have met you two, right? I would never know about e-patients or any of this kind of stuff if I wasn't involved in this. And when you start exchanging information on that kind of level, there's a level of responsibility that comes with that, and I just feel like there's a lot of people who really aren't talking about that.
Yeah, I agree, absolutely, and gosh, you put it so well. You just put it so well, and we need to have these conversations, and hopefully, and I'm sure that those are the kind of conversations that's going to happen at this conference.
Mm-hmm. No, it's fascinating for me to find out that people are doing this. It's so empowering,
Yeah. Well, so they're not going to be going back to the conference then, correct, Autumn? Was that just the introduction and we're done with that?
You mean, are we going to go back to the conference? Are they going to come back in?
Correct.
No, that is the end. So we're kind of wrapping up right now. So just to kind of give you a little bit of a taste of things, because I don't think you got my email, Terry. I think you're going to get one tomorrow. I know you kind of jumped in. I'm so happy you were able to jump in. We're somewhat sensitive to what's going on online or on site because they're at a conference and they've got people who are coming up to them and things are actually happening. So we usually are only with the on-site people, sometimes 10, 20 minutes. I've been in virtually connecting sessions where they've maybe gone as long as 30. But we really try to be really conscious of the fact that we're so grateful for them to come and give us a little bit, but they are kind of doing their own conference thing over there. So yeah, they won't be back for this session, but we are having another session tomorrow.
Right, and that's the one. It's not from Sydney, but it's Sydney time or something.
No, it's the same conference.
Right.
And I thought the conference was in Belfast.
Right, but there was something tied into Sydney time. Is that? Do you know what I'm talking about?
So if you ever watch, you know how on television when they announce like the the different times. I think she was just giving some benchmark times.
I got you. That's what I'm referencing back to.
Yeah,
without my coffee. Without my coffee at 3 o'clock.
Oh, you shouldn't be having coffee at 3 o'clock in the morning. I think it's because Kate was joining in from Sydney, so it was just to give her an idea of the time. And I think tomorrow is going to be a far more civilized time for you in the States. It's mid-morning, I think, if I recollect.
I'm not on that one, but let me just look it up really quickly.
Yeah, and unfortunately, thank you, Marie, for that clarification now with Kate. Now it's coming back to me. Unfortunately, I'm not going to be able to join tomorrow either, so.
Okay.
Yeah.
All right. Well, I tell you guys what, I'm going to stop the broadcast at this point, and we can continue talking offline just to kind of say goodbye to each other if you want to, but I am going to stop the broadcast at this point, okay? So again, there might be a slight lag. So when I say, you know, we're not live anymore, that means that we've stopped. So.